Good evening, Miss. I am Angelica Villario Sarsa from BSN 2B3, and today I'll be performing the handling the delivery. So first is we need to transport the patient per hospital room from labor to the delivery room. And then we need to transfer the patient from the bed to the delivery table. Next is we are going to position our patient into a lithotomy position. Make sure that the mother lies on her back with her hips flexed and knees apart, and also the heels are on a steer up or in a pillow. After that is we need to perform hand washing or hand hygiene, and then don open gloving. This is to maintain a sterile field. After that is we are going to support the perineum using a white sterile sheet. And then we are going to take note of the time and for the fetal delivery and also the gender of the baby. Baby out. (8:52). Gender of the baby, baby boy. Baby girl. Then, after that is we're going to assist the doctor in clumping or cutting the umbilical cord. First is use these. Make sure that we cut it on, I make sure the first clump is at least 0.5 inch near to the baby. And then 3 to 4 inches far away to the cord. Then the doctor will cut the umbilical cord in between, making sure that there is still 1.5 to 2 inches remaining to the baby. Then, after that, it will be the placental delivery. So, once the doctor pulled the placenta, we will say placenta out and then check for the time. 8:53. Then, as based on my research, placenta will be out for 15 to 30 minutes. And then after that is we are, and also for to add knowledge, there are two types of placenta. We have the Duncan and what I forgot the how to pronounce. It's on my spot. Schultz. So Duncan, it is on the fetal side. It is no wrong. Duncan is on the mother's side. It is the dirty or rough side of the placenta, and the what's that? Shoals, and the shoals is the shiny one. It is on the fetal side. Then we need to remove our gloves. And then we need to stay beside our patient and get ready for the blood pressure taking. Based on my research, we immediately take the blood pressure of the mother to detect early complications such as hemorrhage and etc. Okay, BP is 120/80. And then we need to continue this for every 15 minutes. Next is we're going to prepare the stretcher for us to have a smooth transport of the patient from the delivery room to the recovery room. Next is transport the patient from the delivery room to the recovery room, and we need to monitor the patient's vital signs, fundus, lochia, and also the bladder. And in the vital signs, this includes the pulse rate, respiratory rate, the BP, and also temperature. Then make sure that it is all normal. And in the fundus, in assessing the fundus, we need to place one hand over the pubic or above the pubic bone for support, and then the other hand will palpate the abdomen for the uterus, and then the normal finding will be firm and at the midline. If you palpate like buggy or soft, it is a abnormal finding. This the intervention that we can do to it is we can massage this. So if we find some abnormal findings, this may indicate that the uterus is not contracting well. So a firm and located at the midline indicates that the uterus is contracting well. Yes. Then for the lochia, it is the vaginal discharge, and we need to check. In assessing this, we need to check the perineal pad or ask the patient if what is the amount and the order of the discharge. We have three: the lochia rubrus, lochia serosa, rubra. Lochia rubra, lochia serosa, and then lochia alba. The normal one is the rubra. It will happen 1 to 4 days or 2 to 4 days. Then the color of it is bright red. Then the serosa is pinkish or brownish in color and happens 4 to 10 days. And then the alba, yellowish or whitish in color and happens 10 days to 6 weeks. In the bladder, we are going to ask our patient if they have urinated, and then we need to palpate the abdomen to check if there are bladder distension if needed. And also the normal findings, the patient voided for 6 to 8 hours postpartum, and then the bladder is distended. I'm sorry. And then what we will monitor if the patient has an ability to urinate. That's it. And then we need to report everything, every abnormalities and unusualities to the rightful person, to the doctor or the physician. Thank you.